All right, welcome everybody. This is Greg Arnold.
And Starlene Maharaj Lewis.
We are just going to wait another minute for a couple more people to come on, and then we'll start. Thank you. All right, welcome everybody. So today we're going to be talking a little bit about the North Sound Community Hub and how to connect with this program to be a referral partner. So it'll give a little bit of background connected to the work and how people can be connected to it. So first, I want to say that right now all participant lines are muted. Please send questions anytime using the chat box. This is recorded and we are going to post it to the portal to make it available afterwards as well. We will unmute the lines at the end in order for people to ask questions directly as well. So thank you. So first I want to start with the land acknowledgement. We begin by acknowledging with humility that the land where we are today is the territory of the people of the Salish Sea. Their presence is imbued in the waterways, shorelines, valleys, and mountains of the traditional homelands of the Coast Salish people since time immemorial. You can visit that spot to learn more about doing land acknowledgements yourself and the importance of it. All right, so so first the overview of what we're going to do today. So we're going to first discuss a little bit about going quickly, because I know most of you have already been engaged with the ACH work, a little bit about the transformation and what it hopes to accomplish, as well as how the community hub is part of that and its place within the setup. Then we're going to go through and talk about the program and what the pathways are, a little bit about the hub, and then we're going to discuss the referral partners, the role and benefit of that, have any questions and answer period, and then talk about any upcoming webinars. So first, a little bit about Medicaid Transformation. I mean, the main goal in this is to move to a system that's more coordinated. You'll oftentimes, of course, hear about this being called the 1115 waiver. And it's kind of a system to kind of pull together and make the system more efficient, to be able to kind of create integrated whole person care, more coordinated care, closed loop referrals between services, to activate clients to be able to make decisions on their care, accessing appropriate services at the right point, having timely supports for them with standardized measurements, and then having and moving towards a value-based payment system instead of a volume-based payment system. So the community hub and care coordination activities fit in this. We have 9 different ACHs around the area. 5 of them are doing the hub work with pathways. The others are doing other care coordination activities. So it's not that they're not doing care coordination work, but they're doing it in a different method. So we'll talk a little bit about how we view the hub and the pathways work and how it connects to the broader transformation work. So first, this is the way that we at the North Sound ACH are envisioning the transformation activities. We separated them into 4 separate kind of initiative areas. So the first one is around care coordination, and the first one of that is the North Sound Community Hub using the Pathways model. This fits within kind of that care coordination framework that I initially talked about, and being able to make sure that care is coordinated, that we're getting closed loop referrals, that patients are active in their care, and deciding how to engage the systems and learning how to engage the systems. You can also see that we have 3 other initiatives here, the care transformation, care integration, and capacity building. Right now we have 49 contracted partners that are doing lots of work on these areas, many of them, of course, on the phone. So thank you. So first, I want to talk a little bit about the Pathways model. This is connected to, sorry. Actually, I'm going to pass this over to Starlene. I apologize.
Thank you, Greg. So again, my name is Starlene Maharaj Lewis. I'm the hub manager here at Norsound ACH. And so I will move forward in describing what the Pathways model is. What is Pathways? Pathways 101 is, there are 20 identified pathways developed by doctors Mark and Sarah Redding to address 20 areas of risk, as well as identifying those concerns, as well as mitigating those areas of concern. So there are 20 identified areas of concerns. And that's basically the Pathways model in itself. These interventions are delivered by CHW workforce. In the model, they are called care coordinators. So these are field workers that will actively do outreach. They'll reach out to the clients. They'll be able to build those trust relationships and identify those areas of concerns based on the model's various pathways, tools, and checklists. So these are a series of little forms and assessments that all live within a software system. That being said, at this time, I would also like to share with you a video that really describes the Pathways model quite well. So please stand by as we load and queue up this video.
Pathways 101. What is Pathways Community-Based Care Coordination? Pathways Community-Based Care Coordination is a system designed to help people in the community to better connect with the services they need. This happens by empowering people from the same communities to serve as the connectors to services. Community-based care coordinators, often community health workers, are trained to know what services are available and how to assess and understand what services a person needs. Community-based care coordinators look at everything that is getting in the way of good health outcomes: access to health care, housing, employment, safety, education, because it all matters. These barriers to health, or risk factors, are identified and translated into pathways. Each pathway represents one risk factor and the steps that need to be taken to eliminate the risk. There are 20 core pathways: adult education, behavioral, developmental screening, developmental referral, education, employment, family planning, health insurance, housing, immunization screening, immunization referral, lead, medical home, medical referral, medication assessment, medication management, postpartum, pregnancy, social service referral, and tobacco cessation. One of the primary objectives of Pathways is to find individuals who are at risk for poor health outcomes. Because the work is tracked electronically, Pathways can help measure success at eliminating risks and helping people with what they need. The first step is for a community-based care coordinator to engage individuals and complete a comprehensive risk assessment. This assessment, or initial checklist, is used to look at all of the pathways that need to be addressed. Then the community-based care coordinator partners with the individual to work through all of the relevant pathways. For example, a community member is identified because she does not have any place to go to find a medical provider. She would be assigned the medical home pathway, and that pathway would not be completed until her community-based care coordinator confirms she made it to the appointment. At times, for whatever reason, not all pathways can be completed. If that's the case, then the pathway is closed as finished and complete. Even though the outcome was not achieved, all the work and effort involved to complete the pathway and the reason why it couldn't be completed is still recorded. This is valuable information that helps build a bigger picture of what is and what isn't working within our community. A final and important piece to Pathways has to do with how the services are funded. Community-based care coordinators and their agencies receive at least 50% of their payment from completing Pathways, which motivates them to make sure the work is fully done. A completed pathway means that an identified risk factor has been successfully addressed. This payment for outcome methodology is important to the overall success of the Pathways Community Hub model. What is the Pathways Community Hub model? This will be discussed in our next training video.
Hello, and thank you for viewing that video. Sorry. Okay, so going into the Pathways model, again, to reiterate, the Pathways model, it's family-based care on an individualized needs basis. So the care coordinator meets with the client and they are able to serve entire family units. And stand by. Okay, so some historical information on typical care coordination scenarios. What the Reddings discovered, there was a breakdown in the current system as there were agencies that were siloed from each other, no real connectivity, and the client was required or needed to go seek out these agencies themselves, not having that knowledge base and being able to make their own connection points, which can also be very overwhelming with our clients that we serve who are already overwhelmed. With this scenario here, it's very client focused. The Pathways model is very client focused, very client centered, and using the Pathways model, we're able to bridge that gap between the agencies and providing services in a more comprehensive manner to the clients. Okay, so here again, so the Pathways model is housed within the hub. The hub here is care traffic control. So it's a centralized unit that's able to bring all these agencies and services together in one place to better identify the risk needs, assessments, and then being able to provide those referral points for the client. So how might we better be able to integrate these services in one centralized space? This speaks a little bit more to how the community hub model connects entire families with one care coordinator. So now you're not using multiple agencies and multiple case management personnel. And this one care coordinator will connect the client to those services. It's also a client-centered model. So it's based on clients' goals and needs at that time of service. What else does it do? Let's see, it also provides an accountable framework for the referral partners themselves who want to build infrastructure for an effective care coordination network of community agencies. So what that looks like is having the referral partners, the care coordinators will go out and see clients as they attend their health fairs or other areas where they're stationed out in the field. But the referral agencies themselves will also be able to identify those who may benefit from the Pathways model and refer those people into the hub in a streamlined process. Okay, so what else can I tell you about the community hub model? Again, centralized location to provide evidence-based organized network of multi-agency organizations that will use the care coordinators to reach out to those at greatest risk, identify those risk factors, and assure the barriers to accessing medical and social needs are met using the coordinated care framework. And please stand by. Let's see. So basically, we are a patient-centered approach to whole person care. So what is Pathways and what is the hub? Here it really identifies and delineates how each functions and how each is able to serve, and as well as integrate the two concepts into a whole program at the North Sound ACH. With pathways, there's a 20 identified pathways. What is a pathway? 20 identified risk areas. Each factor is identified, again, by the CHW. It's led by assessment forms, which we call our pathways, our tools, and our checklists. These are completed with the client. So again, it's shared decision-making tools that the care coordinator will use to identify these risk areas, assess them, and then provide services based on those needs. And what else? The Community Hub is used to track these pathways. We're able to discover trends through reporting. Stand by. Okay. Through reporting, as well as it's a centralized convening mechanism used for our referral partners to be able to identify those at risk as well and refer them into the hub.
All right. So I wanted to talk a little bit about creating the hub and what it is. Right now, the North Sound ACH stands as the hub. Referral partners are oftentimes, they could be hospitals, clinics, other community-based agencies. These agencies can refer clients that are eligible into the hub. The hub determines the eligibility and then kind of sees which is the best fit for clients to be able to get the services. So right now we have 3 agencies that are enrolled to provide the services with hired community health workers. Right now that is Compass Health, CMAR, and San Juan County. So those 3 hubs, I'll talk a little bit about how the CCA is determined and then assigned for the client or the person that needs the help. So the key role in regards to this is to try to find that risk in the community for people that oftentimes are called rising risk or that could need higher services in the community, to kind of use the tools and the checklists to be able to assign the pathways and then to be able to kind of measure it and track it and see kind of what the outcomes are. One of the advantages of this is we're able to really see what is being used in the community. We can see if there's, problems, for instance, closing housing pathways, difficulties with behavioral health referrals, if there's medical referrals that are being done and exactly what tools are being used and those outcomes from those tools. Some of the examples of tools, for instance, is the PHQ-9 depression screening or the GAD-7 anxiety screening tools. So those are used in the system in order to be able to get data both for quality improvement from the individual agencies doing the work and to improve the efforts of the community health workers that are engaging with clients, but also to be able to see what's happening in our community and within the families that are being served. So the next one, I kind of want to talk about the population that the North Sound ACH chose to be able to begin doing work for community health worker. So these are the current eligibility criteria for the hub. We ask that the client be on Medicaid or Medicaid eligible or dual eligible, that there are residents in our area of Island, San Juan, Snohomish, Skagit, or Whatcom County, that they're self-attesting to a behavioral health condition or it's clear that there's some kind of behavioral health condition that's present. This doesn't have to be something that's diagnosed, and it doesn't have to be something that would classify someone as seriously mentally ill. One of the things that I like to mention is this isn't the same as the previous access to care standards, for instance, that existed in the behavioral health system. And then any of the following, if they have multiple emergency department visits or admissions within the last 6 months, any housing insecurity or instability in their lives, multiple prison or jail admissions in the last year, and any kind of chronic health condition or of child age or postpartum. these criteria are really meant to be able to capture a specific population that we think the hub and the community health worker work could really make a difference on. And also to be able to kind of capture that concept of rising risk or someone that could be at risk of more services in the system. So, the next kind of piece that I want to talk about is what the flow looks like. So, when a client is identified either by the referral agency or by the agency that has the community health worker, that agency identifies them, they believe that they meet the eligibility criteria, they put them into the hub as a referral, and then the hub assesses that eligibility and assigns them to a care coordinating agency to be able to reach out and to be able to set up an assessment, a referral. And that community care agency has hired community health workers that go out and they get a release of information. They complete the initial checklist to be able to see what tools and pathways are appropriate, and then they start doing the work, following up with that client. That information then is entered into the care coordination system, and the hub can look at it and to review the consent and screening, and also to be able to see what's being completed in that system. So it's kind of a closed loop referral back to that hub. And the hub then has the ability to look at the overall data and what's happening. So, referrals are sent to the care coordinating agencies. The referral comes in through a hub through a secure software system called Care Coordination Systems, or CCS, and that ensures the client confidentiality and keeps the protected healthcare information secure that's connected to that. The purpose is to make sure that the incoming clients are promptly assigned to an agency for fast follow-up in the program, and that the community health worker and agency is the most appropriate for that client. So we'll talk a little bit about that as well. So first, this is the decision criteria on how a community health worker or community care agency is assigned. The first priority is if there's a community member, if they have a specific preference for an agency. So that is taken, this is a client community kind of driven model, and that preference is taken first before any other criteria. Then the decision is made if there's a current or prior relationship with one of the agencies that has community health workers, if there's specific cultural appropriateness for a particular agency, if there's any special needs that an agency can meet, and then even distribution among the care coordinating agencies as a last criteria. So I'm going to hand this off to Starlene to talk a little bit about the benefits of being a referral partner and how that works.
Great, thank you, Greg. So benefits of being a referral partner. So first of all, I'd like to again reiterate that we are moving away from fee-for-service, and this model really speaks to value-based purchasing, addressing not just clinical conditions, but also those social drivers of health. So food insecurities, housing insecurities. A lot of our partner agencies who have expressed interest come from that. They're community-based organizations, grassroots organizations that really want to be able to fulfill that community need. So on a community basis, and providing individualized care. Benefits of becoming a referral partner. One, what I really like about this, the CCS system, which is Care Coordination Systems, it's secure. So the information that's provided therein, also the messaging that may be relayed between agencies, between the care coordinator, CHW, and the provider is all secure, and it is HIPAA compliant. So there is that piece which I really appreciate. I also appreciate the fact that it's centralized database of all the current resources. So what that means is that Since it is centralized, what I appreciate is that I'm able to pull reports on the clients that you have referred. Another interesting piece within CCS, the software system, I can pull overall reports amongst all the referral partners, all the CCAs. Each CCA, as well as partner agency, can also pull their own reports on the clients that were referred by them, or that, speaking on a CCA, which is a care coordination agency in this model, they are able to pull reports on all the activity for their CCA that contains all their clients. Supervisors are able to pull reports on their care coordinators that are under their supervision. And then another tier, which I also appreciate, is that each care coordinator, so each CHW, is able to pull reports on their clients. Some things they may be interested in are, open pathways. So when you're actively working with a client, there are open pathways. And as you are able to address that risk, so now you've achieved that goal, you're able to close out that pathway successfully. So that's really interesting. The other piece is making that closed loop referral and that ability to follow up. So within the system, you're able to follow up with your client. That is done on my next bullet point, which is the referral browsing ability, which is HealthBridge. Within that piece, it's a link. So it's a software link that lives within the CCS system. And HealthBridge is, we're going to speak about this in depth a little later on. However, HealthBridge is a link that provides a mapping service and also a referral service, not just between the hub, North-San ACH hub, and the referral partner, but also between referral partners. So potentially a referral agency can refer and speak to another referral agency and get notifications of that to their work email, which is also a really big benefit. HealthBridge also provides a mapping service. It looks like Google Maps. It's very similar. There are pins on the map. You're able to do keyword searches and look up referral agencies and get the contact information, directions. So, and actually the hours, the server, the contact information as well. Okay, so the next step is the process. So those who are interested in becoming a referral partner. The first step is to create that secure link, and that's actually done through the CCS platform. This is the welcome page. And how that's done is basically email the hub. So one of the hub staff will receive your email. The reason for this is we need to set up your user name and password, so your login credentials. And we will send that back to you, and you will log in. And really that's it for that process. So very simple. This is the HealthBridge piece. So what is HealthBridge? Once you have logged into CCS, there is a link which will say log into HealthBridge, and you'll be navigated to this page. Next slide. What does HealthBridge do? So there's two sites, or two faces, I guess, to this. There is the internal facing site, which lives within CCS and the secured messaging platform. There is also the public facing site. So literally any client, any community member, any individual can type in healthbridge.care and they will be navigated to a public facing site, which will have your contact information. As I mentioned before, your name, your contact information, directions, and what services you provide. So they'll be able to navigate that as well. The benefit is that each individual profile is owned by the referral partner. What that looks like is you will populate all the data fields with your information. It's also free. So that's a bonus. Free, and also it's since it's online and since you own that particular piece of your user profile, you're able to update as needed. So say if you have one particular person that is designated to be the person who is linked into HealthBridge and they transition out, you're able to go in and change those text fields as necessary. So how to access HealthBridge? Again, in the system, There are two pieces. Again, this is more for providing services and looking up services and speaking to other partner agencies. Once you are in CCS, there are a couple pieces here. So I'm not sure if you're able to see my cursor, but if you are, this is what your page will look like once you link. This is the little link, log into HealthBridge. So if you can't see my cursor, if you see along the top bar, there are community resources, add new, export, upload, and log into HealthBridge. You would click on that, and to the right is the little text field box that would populate, and you would enter all your information. I'm not sure if this slide is replicated, so I would also like to point out how to make an actual referral. That would be done in this tab where my cursor is pointing at. It is called Caseload at the very top bar of menu items. You would literally click on that and the drop down would populate refer client to hub. And that's all you would do. Okay, so back to HealthBridge. Your agency is on a menu list. It's based by keyword searches. So I had actually typed in North Sound ACH and we popped up and we are open. So for yourself, the first time that you're in here, you would then scroll down on this page and you would click, again, if you can see my cursor, it is the details. It's a link. It's beside what's next. There's details. You would click on that and it would then take you to a page where, again, you can update your text fields. So you don't always need to be in CCS to be able to update your agency profile. That is also a nice bonus. Within healthbridge.care, you will have your profile standings. As you can see at the top, we have some menu items up here, home, about, referrals, there's my name, signing out. Also, you will see along the left-hand side, a list of menu items. The first one's called referrals. Once you make a referral, your messages, all your messages actually will be archived in that area. So you can always go back and refer to them. If you want to change, I didn't put a little avatar or a picture, but you're able to do so if you click on my profile. So, next slide. Okay, how would you actually make a referral? Here, you're going to be clicking on contact. So when you're in the agency, for example, if you were looking for a community action agency that catered to those who had concerns with housing, and you were looking for an agency, you did a keyword search and you found your agency. Once you, this is an example, oops, I apologize. Once you have your list, it'll generate a list and you'll scroll down, select your agency. I'm trying to do that again. You will have the agency name, some information, and at the end of this header profile, you will have the contact button. Again, if you can see my cursor, it's in green, and you would click on that. It would then populate this page, and you would fill in your contact information. And you would send it off. And the nice thing about HealthBridge is once your referral is received or responded to, or follow-up questions, you will receive an email to your workplace inbox. Whatever email that you populate in your agency profile, you will actually receive notification that you have a message waiting for you in HealthBridge, and you would click on the link and it'll take you back to HealthBridge. So that's also a nice feature. And this is the second way of accessing HealthBridge internally. So say you've made your, oh, it does have a nice bigger one here. So here's Caseload. We're gonna work on this first. So you're making a referral into the hub. You would click on Caseload. It'll have a drop-down menu, would select client referral to hub, and you would then refer that person into the hub. The hub would then check for eligibility based on the population focus criteria that Greg mentioned in an earlier slide. So another way to refer people, make referrals for your clients is to log into HealthBridge. You have your 4 links, the last one being log into HealthBridge, and you would click on that. Okay. Those of you who may be interested or have further interest in reviewing what the hub looks like, the CCS platform, as well as healthbridge.care, I am more than happy to meet with you and provide a demonstration of how this all ties together, what it looks like in real time, and the steps that are necessary to set up your own username and account. And this is our contact information, which is hub@northsoundach.org.
Okay, well, thank you. So also I wanted to, this is Greg again, thank you. These are also our contact information for me, the ACH Clinical Director, greg@northsoundach.org, and Starlene as well. And Michaela, who also does some of the hub work for our team. I would like to open it up for questions, you know, for any kind of questions that people have. So the upcoming webinar that we have for Wednesday, October 30th is around community information exchange strategy for partners. Please complete the webinar evaluation. The link will also be emailed to you. And then let me unmute people in order to take questions. All right, everybody should be unmuted now. So hopefully that worked without providing a lot of feedback or trouble.
I have a question. Can you hear me?
It's a little bit faint. Let me see if I can turn it up a little bit.
Okay, I'll talk a little louder. This is
Okay.
in Island County. So are there currently any Island County community partners that are signed up to be a hub referral source? And
Yes, actually, the San Juan Resource Center is a partner.
that's not Island County. That's San Juan County.
Island County, I apologize.
That's okay.
No, right now we don't have a CCA that is serving Island County.
Okay.
You know, one of the biggest expansion points that we're looking at as we're moving into next year is to be able to fill that hole.
Okay, so it probably would not be a good idea for us to sign up to be a hub referral partner.
Well, I mean, I do think it still allows the use of the HealthBridge system, which can be
Right. True.
to be able to see and to connect with other agencies. It also would allow for an existing referral network to be set up when we do have a CCA. So it would allow a little bit more of a running start, I would say.
We can go ahead and do that even though we wouldn't be making referrals.
Yeah, there's nothing that would prevent that from happening.
Okay.
We can set up sign-ups still for it. We can, you know, you can orientate yourself to the HealthBridge system and start using that. And when there is a CCA that's serving the region, it would be quite simple just to go up and start making referrals for that.
Great, thank you.
Yeah. Okay. I'm not currently seeing any questions in chat either. You know, I definitely think that there's a couple benefits, you know, to being a referral partner. You know, one is the connection to HealthBridge and what that can do in connecting partners. The other is, you know, really being able to kind of engage in a secure referral system into the hub. And to be able to allow kind of a really personalized service to be provided to your clients that meet the eligibility criteria. If there are any questions about whether someone meets the eligibility criteria, I would really strongly suggest that people make the referral into the hub and that you let us figure that out. You know, one of the pieces around that you know, I've always had a little bit of concern about is, you know, that people sometimes think that it needs to be a diagnosable behavioral health condition or a serious behavioral health condition to qualify, and that's really not true. And we're definitely willing to be able to, as the hub, be able to take that referral and be able to look at it.
No, I just need to.
Okay. If there are any more questions, definitely chat them in. I'm going to mute the lines now. We do have our emails. Let me go back a couple of times. So, you can reach out with questions either to me or Starlene directly, or also to the hub@northsoundach.org. We are certainly willing to answer any questions. We're willing to walk through and do demos of both the care coordination system, CCS, and of the Health Bridge component. I think there is a lot of potential benefit to both systems for the region. So.
If I can add to that too, so speaking to the earlier question as well, I wanted to mention with this presentation is also an overview of all the different moving parts. That's why I'm also happy, because I have done it with referral partners that are now active in the system. The nuances of each community-based organization or agency, what I found is they're trying to find the best fit for their organization as well. So it's different for every agency. So having those one-off conversations and demonstrations, I've found really useful in being able to help the agency understand how these two software systems are able to, because they work in tandem, and they're able to really promote use of their own agency's mission and visions. An example is a CBO that is in our county. And they originally were looking for a space that was not on paper, and had a list of different agencies that didn't live on paper, and they were able to look up different services provided, again, not being on paper. So that's when we had a chat, and we discovered that HealthBridge would be a good fit. And the added bonus is having that connection piece. So having the CHW piece of bridging the gap between providers and services, and having that client as the central, the focal point of it all. So again, I reiterate, please reach out, and we are more than happy to be able to have those conversations. It takes a deeper look into how those systems do actually work in tandem, and how you're able to navigate it's a pretty simple process. Thanks.